Hello, my name is Rosa and I'll be doing the Foley Catheter Insertion and Removal. So with that being said, let's get started. Knock, knock. Hello, my name is Rosa and I'll be your nurse today. May I see your wristband? Patient, show me your wristband. May you please state your full name and date of birth. They state their full name and date of birth. I've viewed and verified doctor's orders. The doctor have ordered for a Foley catheter insertion and removal to be performed. Do I have your consent to do so? Patient stated yes. What I do next, I provide privacy, put my items on a clean surface, perform hand hygiene. Do you have any allergies to latex? No. Shellfish? No. Iodine? No. Chlorohexidine? No. On a scale from 0 to 10, 0 being no pain and 10 being the worst, what is your current pain level? Patient state 0. Perfect. I then now, by the way, we are performing the Foley catheter due to the fact that you have not been urinating for the past 12 hours, and the catheter will help void out the urine. While inserting the catheter, I will be assessing and cleaning your peritoneal area. You may feel pressure and a little bit of pulling, which is normal. Do I have your consent to continue? Patient said yes. Is now a good time? Patient said yes. And then I perform hand hygienes, put garbage within reach, bed to hip level, head of bed to the lowest position it could go, the side rail on my side down, and more hand hygiene. Put on clean gloves, but don on clean gloves. May I remove the blanket? Patient said yes. I roll it back to foot. May I lift your gown? Patient said yes. I lift it and put on bed bath towel. In the same token, may you please flex your knees, move your ankles upward, towards out, and let your legs drop outwards. Patient had performed task. I put waterproof drape, bed pad underneath between patient legs and underneath peritoneal. And then I asked patient, may I lift the bed bath towel and your gown? Patient said yes. I rolled it up halfway while exposing the abdominal area. I am now going to touch you. Is that okay? I will touch the lower abdominal to assess for bladder distension. Patient stated yes. So I palpated, and there is bladder distension present. Okay. I then now assess the peritoneal area. There is no redness, no rash, no open sore, and no skin breakdown. And it looks clean. If it did not, I'll clean it for the patient, but there's no need for that because it's clean. And then what I will do, I will remove my gloves, perform hand hygienes. Let's move this to the side. Take my Foley catheter kit, open away catheter kit, remove, place this here, fold the lid back, put it to the side right here at reach of the foot of the bed. Let's place this in the trash. Let's open this away. Side to side. Move this away. I then now take drape and it drop. Put it in between the patient's legs underneath the peritoneum. That's done. Take my sterile gloves, open it away, perform hand hygienes, don on my sterile gloves. Take the drape, and sterile, put it on patient, exposing the genital area. Now, I will take my lubricant, squirt here into the 8 empty spots. Let's remove this, put in the sterile place, remove cap bag, dispose, take my pre-filled syringe, insert, let's leave this here, place this back, take my iodine, open, squirt the iodine onto the cotton balls, take my kit and place it between the patient's legs. I take my non-dominant hand and I inform the patient that I will now be cleaning her genital area from front to back in the peritoneum. With that being said, here I go. I spread the uvula with my non-dominant hand. I spread the uvula with my non-dominant hand, and with my dominant hand, I take the embedded iodine cotton ball, wipe front to back, dispose, take another one, wipe front to back on one side, dispose, take another one, wipe front to back on the other side, dispose. And then let's move this out the way. I don't want to contaminate. I informed the patient that I will be inserting the catheter and I'm going to need them to bear down. So with that being said, I will be inserting the catheter, and as I insert the catheter, I'm going to need you to bear down. Now, I insert the catheter through the urethra and ask the patient to bear down and continue on inserting the catheter until flash of urine is noted. Afterwards, when a flash of urine is noted, I continue on inserting it about 1 to 2 inches. Then let go of the uvula and hold it into place and take my dominant hand, and I'm holding the catheter with my non-dominant hand, and with my dominant hand I squirt the pre-filled syringe solution to the catheter to so it could go into the indwelling balloon. It's filled, And then I gently tug on the catheter while letting loose the catheter, and it's securely in place. I take syringe off, grab the catheter, and place it. But before I place it, let's get a tape and tape the catheter on the patient's thigh. Then grab the catheter and put it on the bedside station, lowest position to the bladder, because we don't want it coming back up. Remove all my supplies. And dispose of it in the garbage. I'll just set it here, but just know I dispose of it in the garbage. Remove my gloves. You may relax, well, don't relax your legs yet. Remove my gloves. Put it in the garbage. Perform hand hygiene. Don on some clean gloves. And then what I will do after donning on the clean gloves, I will take my drape and rip off my drape. I don't want to do that because I'm still reuse this. So I'll rip off my drape and tell the patient they may relax. If I have not placed the tape yet on the thighs, I will place the tape on the thighs because their legs are relaxed. I'll leave the bed pad, waterproof bed pad in place due to the fact case there's some leakage. I'll remove the towel, put in the dirty linen. I asked the patient is okay. They said yes. I'll remove gloves, perform some more hand hygiene, put down gown, and put the blanket back up. Put bed to the lowest position. It is locked. Make sure patient is comfortable of the headbed, and put car light within reach. Thank you for being a great patient. And that's it for the indwelling catheter. But now it's time to remove the catheter. So I had came in, well, I knocked on the door, came in, and I already looked at patient chart, identified the patient with 2 identifiers, reviewed the doctor's orders, and then asked for consent, provide privacy, and gave patient rationale of to why I'm performing the procedure, which is to see if they could urinate without the use of catheter. So with that being said, and no, they're not allergic to any latex, shellfish, chloroiodine, nor iodine. I already provided privacy, perform hand hygiene, and I got my trash can within reach, bed to hip level, side rails near me down, and the head of the bed is already down to the lowest position. Okay, may I pull your sheet back? Patient said yes. I pull the sheet back. Okay, may I pull your gown up? Patient says yes. I pull the gown up. Now place a bath towel or sheet onto the patient while lifting the gown and bath sheet up to abdominal area. And then I ask the patient to flex their knees, move their ankles up, to the side and let their legs drop. And then, since I already have a pad here, a waterproof pad, there's no need to put the waterproof pad because I'm going to use the same one. Okay. I then take the tubing, let the urine drain all the way out, all the way to the catheter bag. Place it to the floor. It's drained to all the way to the catheter bag. Take 2 alcohol pads and including my cylinder. I open up the catheter, tear open alcohol pad, wipe exit port, unclamp the catheter, and let all the urine drain into a graduated cylinder. After that, I clamp catheter, take my second alcohol pad, wipe exit port, then attach it back onto catheter bag while disposing of the alcohol that's being used. Put it on a flat surface at eye level and look at the amount, which is 200 ml. The color is clear, there is no odor, the consistency is liquidy, and that's 200 ml. I'll dispose of this later towards the end. Put that away. Then I take napkins and my 10 cc syringe. I deflate the indwelling balloon with my 10 cc. It will deflate on its own, but right now it will deflate. Okay, it's all gone. Now, while securing it in place with my non-dominant hand, I take my napkins with my dominant hand, then place it in my non-dominant hand, and inform the patient, instruct the patient to take a deep breath. Now they are going to slowly exhale while I withdraw the catheter. With that being said, take a deep breath. Now slowly exhale. While withdrawing the catheter, the patient is exhaling. Okay, catheter is out. I assess the tip of catheter for any blood, mucus, or infection, and there's none noted. Hold it up. Dispose of catheter and my 10 cc syringe into trash. I threw it into the trash. Okay, take my towel and put in the linen. You may now relax your legs, and I also remove the tape. I'll throw that out at the end. Let's remove the gloves, dispose of it in the trash, perform hand hygiene. The patient has relaxed the legs. The tape has been removed from the thighs. I'll put the patient gown down. I'm going to leave the pad on the bed just in case if the patient have a little bit of leakage left for protection. Cover up the patient. Make sure the bed's at the lowest position. Bed is locked, side rails up. The head bed is comfortable for the patient. Car lights within reach. Perform some more hand hygiene. Don on some clean gloves. Take my cylinder that's full of urine. Dispose of it to the proper receptacle. And everything that I have used has been disposed. Take off my glove. Perform some more hand hygiene. Thank you for being a great patient. Is there anything else that I could do for you? Patient says no. So with that being said, also the car light is already within reach, and that's it.